So for the continuation, we will start with chromosome 17. That is chromosome 17 is for carcinoma breast, that is BRCA1. BRCA2 is for chromosome 13, and medulloblastoma, neurofibromatosis, ovarian tumor, P53 gene. P53 gene is for the tumor suppressor gene, and chromosome 18 is for hereditary hemorrhagic telangiectasia. Pneumatic pills disease is, as you all know, that is most common lysosomal storage disease, and Edwards syndrome. Trisomy 18, chromosome 19 is for myotonic dystrophy. There will be a disarrangement of the myocardial muscles, which will cause for the muscle as per se, for the whole body system. So there will be muscle weakness and various other linked, it's a multi system skeletal disorder. Gene for insulin receptor, and chromosome 20 is for MODY. MODY is a diabetes mellitus. In between diabetes mellitus 1 and 2, that is why sometimes we call it diabetes mellitus type 1.5. It's a autosomal dominant condition. In the history, if you get the disease is going through all the generation, and then you can say that it's a MODY. It's a sometimes you will get a tricky question in the exam like that. So prion disease, it's a protein particle which causes it's the protein particle which causes the the disease. So that is transmissible spongiform encephalopathy. For chromosome 21, we have homocystinuria, is a disorder of the methionine metabolism, and amyloidosis in microscope we can see apple green birefringes, and it is amyloidosis also. It's a multi-system disorder, so we'll have to make another video on that. And for chromosome 22, we have meningioma, as the name is self-explaining that the disease arises from the meninges. So what we can see in the CT scan is the light bulb sign. You can sometimes, most of the time, you get an image-based question on the light bulb sign. You can very easily Google that, and you can see an acoustic neuroma. In the earlier studies and in the earlier books also, you can see that the superior vestibular, it says the superior vestibular nerve is the most common and commonly affected in acoustic neuroma, but in the recent studies is the inferior vestibular nerve. These all things you have to correct if you have the older notes. Neurofibromatosis type 2 and digestive system. What you see in digestive system is the absent thymus. And for chromosome X, we have multiple diseases. For chromosome long arm, we have gene for androgen insensitivity syndrome, fragile X syndrome. If you see in the history that the patient has complete mental retardation, that is fragile X syndrome. Testicular feminization, SCID, and X-linked agammaglobulinemia. Fabry's disease is for the alpha galactosidase deficiency. Lesch-Nyhan syndrome is for HGPRTase enzyme deficiency. HGPRTase is the purine and pyrimidine metabolism enzyme. That's a vast topic. We cannot say for but very peculiar thing about the Lesch-Nyhan syndrome is, in this patient you can see the patient will be self-mutilating, like sometimes the patient will be biting his tongue, or he will beat himself. That is self-mutilating behavior, that is very peculiar of Lesch-Nyhan syndrome. Hemophilia A and hemophilia B. Hunter syndrome, that is iduronate 2 sulfatase enzyme deficiency, G6PD deficiency. And for chromosome P, for the PT term, you have chronic granulomatous disease. The responsible gene is for that is the List gene. List gene is responsible for the docking protein, which makes the lysosome to dock with the granule in which containing the waste material to degrade. So in chromosomal chronic granulomatous disease, the List gene is non-functional, or defectively functional. So the List gene causes chronic granulomatous disease, Duchenne muscular dystrophy. You see that it's a peculiar posturing in the children. You see while rising up, that's the Goer sign. And the monkeys, you can see ATP7A gene. In unlike in Wilson's, you have ATP7B gene. So these are things to remember, and these are the short very short key words you can look for in the sentences, so that you can easily identify the correct answer. So this is from my side. If you want this in PDF format, you can visit the discussion link below, and you can download it. And if you like our effort, you can comment below, and like, share and subscribe. And thanks for watching.